Hello, friends. Welcome back to our study of mind rubrics. So, today I'm going to talk about a very big rubric, a grand rubric that is anxiety. And I am going to do some of its sub rubrics with common remedies for anxiety. So, let us start by understanding the dictionary meaning of anxiety. So, this is what anxiety means. Anxiety is a state of feeling nervous or worried that something bad is going to happen. So, I am constantly feeling that something may go wrong in the near future, and it can be about anything. It can be about my daily chores, it can be about my work, it can be about my family, it can be about my health. Generally, I am feeling something is going to go wrong in my life, and I am constantly worried, tensed. What is going to go wrong? And this is very important. I am not clear what is going to go wrong. Something is going to go wrong. Not clear what exactly. So I am going to the clinic from my house. I have started from my house, and my wife is anxious. Oh, will he reach there on time? Will he get there? Will something go wrong? Will he meet an accident? So she's anticipating something bad is going to happen, but what, not exactly one thing. It's not just accident, it's not just time, it's not any one specific thing. It is about general, anything can go wrong. So for example, I want to bring a glass of water, so I am thinking, oh, is this water good? Should I drink this water? Oh, when I am holding this glass of water, and then when I am trying to give it to someone else, will the water fall down? Can this happen? Can that happen? So there is always, the mind is always, can this happen? Can that happen? Will this go wrong? Will that go wrong? What will go wrong? How will it go wrong? Can this go wrong? So what is it that can go bad? Any In any situation, what are the wrong things that can happen? All that I am thinking of. I am thinking of all those wrong things that can happen in any situation, and and feeling that that wrong thing will happen, right? So what is important in anxiety? Firstly, what we should remember is that bad is going to happen. In that situation, something bad, something wrong is going to happen, but what bad is going to happen, not clear. So there is uncertainty. It may go wrong. Maybe the water is not good. Maybe there will be a traffic jam. Maybe I will meet an accident. Maybe. Uncertain, doubt, constant doubt. What can go wrong? Where can it go wrong? What will happen? And along with this, all this kind of, feeling, constantly feeling something is going to go wrong, something bad is going to happen, something wrong is going to happen. What is going to happen? Hmm? Along with that, you may also get physical symptoms when patient is anxious, like you may see the nail biting, like we saw in the picture. Nail biting, the eyes are wide open, worried, the face, in the face you can see the wrinkles on the forehead, eyes are wide open, nail biting, teeth. hmm? Along with that, palpitations, trembling, sweating, feeling what is going to go wrong, what is going to go wrong, and along with that, getting very anxious. Okay, breathing becoming heavy, heavy breath. So this, when you see this feeling, so most important to make it very simple is if patient starts telling you that I am always thinking what is it that will go wrong in this situation. I am constantly feeling early morning I wake up and I feel will this day be good, will something go wrong today. This is also anxiety, always feeling something wrong is going to happen in the future. Hmm? So now that we know what anxiety is and what it actually means and what exactly you have to see in patient expression. So just to repeat, the most important expression of anxiety is constantly feeling worried, tense that something wrong is going to happen. Something bad is going to happen. My health is going to go wrong, my reports will come wrong, my I will meet with an accident, my work, I did with so much effort, it's going to go wrong, something going to go wrong. When you see this feeling as constantly being narrated by the patient, then the important rubric that we need to choose is anxiety. Now anxiety, as I already told you, is a big rubric, it's a grand rubric, and there are many sub-rubrics and many remedies in it. So what I have done is, from my little experience, I have picked up common remedies and I am going to explain those common remedies and a few common sub-rubrics from the anxiety uh, rubric. So these are some of the common rubrics that I have found, common remedies that I have found useful with relation to anxiety. So the first and most important remedy is arsenic, and all of us are familiar with arsenic. So in arsenic, all of us know that he is always thinking that something is going to go wrong, that his health will go wrong, that his wealth will be lost, that his uh, family member will fall in. So they are constantly anticipating that something will go wrong, something will be lost. The most important thing in arsenic is this doubt that I will lose something. So for example, I remember one patient of cancer, she had uterine cancer, and she said, when I have this pain with my cancer, the pain sometimes becomes so intense that I start to collapse, I start to faint, I start to sweat. And when I start to sweat and when I start to faint, then I realize, oh my god, now I am going to fall down, now I am going to faint. And at that time, I become worried that, okay, I am fainting, I will fall down, but the doors and windows are open. So I said, what's the problem if the doors and windows are open? So she says, no, then the robbers will know that I have fainted and the doors and windows are open. They can come in and they can take everything and go away. There will be no one at home. So I get worried about that. So this is arsenic, that even at the deathbed, their main problem is that their property or their money is going to be robbed by someone. Even they cannot die with peace. At deathbed also they are thinking, oh, what about my money? What about my savings? Are they safe enough? So that is the main thing of arsenic. Safety, insecure. They are always insecure that somebody is going to take away my money. I am going to lose. So that is why arsenic, because he is constantly anticipating that someone is going to take away my money, they are very worried that something bad is going to happen. One more patient I remember, she said, I always have this constant feeling that something bad is going to happen. My health may be wrong, my family, something will happen. I'm constantly worried and I keep pacing around in the house. becoming worried. I said, what are you worried about? She says, I can't tell you what specifically. I feel maybe this wrong, maybe that wrong. And the overall sense is maybe I'm losing something, maybe I've lost something. So one of the main remedies for anxiety, when you lose something, when you have lost something, you know, I lost somebody, lost a vehicle. So somebody robbed my vehicle. So that causes tremendous anxiety, restlessness. They cannot tolerate that they have lost a property. That is the main thing of arsenic. That something bad is going to happen, and that bad is especially related to some kind of financial loss. Hmm? And so that this financial loss does not happen, arsenic becomes very, very cautious, very, very meticulous, very, very systematic, perfectionist, fastidious. All this comes from this need that, if I am not particular, if I am not fastidious, then I will lose everything. Then my whole money will be gone. Then my whole property will be gone. So I have to be very cautious, careful, fastidious, meticulous. So the next remedy is Kali Karv. Kali Karv, again, we all of us know, is very anxious and worried that something bad is going to happen, something wrong is going to happen to my health, to my property, to my bank balance. Oh, it's going to be lost. And again, Kalika also is very cautious, very methodic, very methodic, and very mm, routinistic. Okay, so routine means what? If you hear a patient telling you that, doctor, for the last 20 years of my job, there is not one single day that I went late to my job, or there is not a single day that I have taken unnecessary leave. I will never take a leave. Every day morning from 9 a.m. to 5 a.m. is job time. Then it is 6 p.m. 9 a.m. to 5 p.m. is job time. Then 6 p.m. is walking time. 7 p.m. is rest time. 8 p.m. is dinner time. This does not change for years. This is my routine for years. Nothing changes, doctor. It's I live so meticulously, so systematically, so methodically. Nothing changes. I am very religiously doing and taking care of my health, my job, and my family. And I expect the same from my family. If my family member, they don't study well, if my children are not studying well, if my wife is not doing her cooking or her household work properly, I get agitated, then I start fighting. Huh? I become anxious. Oh, now what will happen? Now what will happen? Now what is important in Kali Karp is that till here, no, arsenic, Kalika seem very similar. Arsenic also is methodic, fastidious, you know, all this is okay. But in Kalika or potassium, the main thing is, when they fall ill, they want someone to take them to the hospital and look after them and take complete um, care of them. They themselves will not go to the doctor. They will expect, okay, my husband should take me to the doctor. Without him, I cannot go. So even if in the clinic chamber you see that, patient has come and you say, I generally talk with the patients alone. So please, I will request your husband to stay out. So they'll say, no, no, doctor, I cannot give case without him. You have to. I cannot. So once I remember one patient, she had tuberculosis, and she was her husband was very busy. So he told her, please go to the hospital alone. This time I cannot come with you. So with lot of pushing, she went to the hospital. But even after going there, after waiting in the waiting room for 2 hours, after her number came, and when she entered the doctor's chamber, she immediately said, no, I don't have any problem. I will come tomorrow with my husband. She did not give any symptom to the doctor just because she felt nobody was there along with me. So that is the main symptom of Kalika: fear of being alone, fear of darkness, cannot stay alone, cannot do anything alone. But this aloneness is out of dependency. I cannot do anything on my own. Now, for example, here Arsenic also wants someone. For example, Arsenic, he will, when he falls ill, he will not go to the doctor. He will stay in his bed, and he will say, if I go to the doctor, he will ask for money and give the same antibiotics and the same antipyretic. It is better I take those medicine and I take rest here. And he will request the whole family to stay at home. Why? Because when, if a emergency arises, then you will take me to the doctor, then you will take me to the emergency ward. Going now, just because, going now to a doctor just because I have some small cold coryza will be, waste of money. So I'm better off waiting at home, taking medicines that I already know, and get better. But the whole family should stay home in case of emergency, not that I cannot do without them. In case of emergency, they will be needed, so they should be present. So Arsenic also, one of the main rubric is holding on to people, not letting them go. They will ask their son to stay at home. Don't go to college today, you stay at home, no problem, you stay at home. I am ill, maybe we will need to go to the doctor. So that is the caution of Arsenic. Kalika is more complete dependency. I cannot go there, I cannot meet, I cannot narrate my complaints to the doctor. That is the difference. Then the next remedy is Kali Ars. In Kali Ars, again, there is anxiety like Kali, like Arsenic, but it is said to be the pinnacle of anxiety for health. When you see, the anxiety is especially getting concentrated with regards to health, only health, not with regards to other issues, not with regards to my work, not with regards to my family members, but the main focus seems to be on health. Then it is Kali Ars. Obviously, Kali Ars will be anxious about other aspects, work, and that also, but that will not be the central issue. He will keep bombarding you. My health is most important. My health is most important. Right? Then you have the next remedy, that is phosphorus.